We're talking today to Dr. Tariq Ahmad. Dr. Ahmad is a UK cosmetic and reconstructive surgeon. Hi, Dr. Ahmad, how are you?
Hi, pleasure to talk to you.
Lovely to talk to you today too. Dr. Ahmad, today's discussion is going to be about reconstructive surgery and about breast augmentation. So what is breast augmentation surgery and why do women seek breast augmentation surgery?
Okay, well, obviously it's in essence surgery to enhance the bust profile. It's usually undertaken with implants, but there are other methods. Quite often motherhood and breastfeeding, which is wonderful, but it can result in what I call post-lactational involution or deflation of the bust, and this can give rise to a loss of the feeling of femininity and self-confidence in women. And I would say sometimes this category of surgery can be very rewarding in seeing that confidence and sense of femininity restored. These types of women are doing the surgery for themselves, not their partner. In fact, I should say, I always feel a little uncomfortable if there is an element that the partner is seeking the surgical procedure more than the patient. You shouldn't be pushed by it for the partner's benefit. But also today, of course, media, comparison with one's peers, all this has had an impact in promoting an increase in such procedures. But when done appropriately for the right patient, you get a fantastic outcome.
How will I know what implant size is right for me?
Yes, well, it's very important that the surgeon and the patient are thinking from the same hymn sheet, and that what the surgeon thinks the patient wants is actually what the patient wants. And today it's not just size, but also shape and the type of filler, the covering of the implant. There's a whole host of new types of implants coming out. Initially, it's quite difficult to be able to cope with all that variety, but actually I find today it's actually much better because you can really fine-tune and tailor the type of implant to the patient and what that patient would want. So in terms of the shape, it's not just the volume, but the profile, whether she wants to look natural or have upper pole fullness, or the width and the height of the implant. And there are several methods to find out what the right size is. Obviously, you can use sort of sizes that are sort of, bogus implants that you can just give to patients and they can try them out for a day or two under a new brassiere and see which size they feel most comfortable with. I often use what I call the rice in tights technique. Get a pair of stockings and you fill the foot of the stocking with a certain weight of dry rice or wet rice. You can tie off the top of the stocking and you can make several dummy implants that way and place them in a bra. Again, when you feel comfortable, you weigh that rice, and amazingly, it's a fairly good correlation or gives a guide to the surgeon to the volume of the implant that he needs to choose and select.
What's the difference between silicone and saline implants?
Okay, well, all implants have a silicone shell. The filling can be different. Saline implants are just filled with salt water, so they're like an empty bag that you fill on the day of surgery. As such, there's going to be some variation on the day, depending on what I think the patient wants or needs. But also, I will not be able to fill that implant absolutely perfectly, being only human. And so they tend to have a higher chance of rippling. And like if you bend a credit card regularly, eventually they can crack. And so they have a slightly higher chance of rupture. But it's not dangerous because they're only filled with salt water. But overnight, your bust can deflate. Much more common to use are silicone gel-filled implants. And again, there's now a variety of gels. Ordinary gel, it's a little bit oily, can run. But today, we tend to use cohesive silicone gels. And these are firmer. So if the implant ruptures, in fact, you can slice the implant, and the gel doesn't run out. It just bulges forward like gummy bear, or as I sort of say to patients, like cutting warm, soft brie cheese, just bulges, which can be reassuring for the patient. Over and above that, you do need to consider the covering can be smooth or textured. The textured implants tend to remain softer longer. And there's a relatively new type of implant available now in the UK and in parts of Europe. These have been used in South America and Australia for 30 years, and they're covered with polyurethane foam, which is meant to have an even lower chance of the covering that your body makes around the implant becoming firm, so preserving softness of the implant over a longer period.
Can you tell me briefly a little bit about the procedure involved?
Well, there's two main things to consider. How do you get the implant in, therefore where the scars are going to be, and where do you place the implant, or the pocket? Now, the most common and most reliable and consistent method is to take a approach under the fold of the breast. So it can be anything from 5 to 7 centimeters scar in the fold, so it's fairly well hidden, and usually scars heal very well. You can, however, put implants in via the nipple and also via the armpit, where the scar is less is visible. But those techniques are a little bit awkward to do, so the consistency and reliability is less. And then you want to consider where the implant is going to be placed. You can place it under the breast gland, but on top of the muscle. And that depends on your age, sex, your age and your size of the breast, and how much breast tissue you have. If you have very little breast tissue, you can disguise the implant more by placing it deeper under the muscle, or in fact you can put it under a little bit under the muscle and under the breast, the so-called dual plane. All these things need to be discussed in some depth with the patient, and it's different courses for different patients.
Can implants correct mammary asymmetry, and do they ever cause it?
Well, you know, no one is symmetrical, and you will not be after surgery, but you could be asymmetrical. That can make you. Now, if you have a modest difference in the breast volume, I don't tend to use different size implants because they don't come in an infinite range or volume range. There are jumps, and so often there's slightly different shape. We have a different volume, and so you may make the asymmetry worse. But if there's a large asymmetry, certainly yes, I have used them to correct and improve that asymmetry, and it works very well when it's done for the right reason and when you've done the analysis fully and appropriately. Often there's an underlying asymmetry before surgery that's not noticed by the patient, and so it's important to examine not just the breast shape and the fold, the level of the fold, but the underlying rib cage, which can be asymmetrical. Although different implants can be used to correct asymmetry, there are other techniques available. Particularly more recently, we've used fat grafts to achieve symmetry in the breast if there's a degree of asymmetry.
Thank you, Dr. Ahmad. Thank you so much for speaking to me today.
You're welcome.